Worryingly, deaths which are linked to heroin misuse and morphine-related medication abuse have more than doubled since 2012. Was that your choice to come off it completely, or...?
Well, I wanted to get off it quick as soon as I found out my wife was pregnant.
The patient-doctor relationship is the most important part of general practice. You need it to be able to function as a GP.
That's the delicious looking doctor.
I'm not sure about that. Most people say, oh, he looks like David Cameron.
It's true.
If I see a patient who fears having an operation, my approach is usually to try and understand why first. 90% of our job is listening to patients.
Being straight with you, I'm scared to go to the hospital. I'll be honest with you, I even know it's a local and I know I'm awake. I don't care, I'm not going.
OK, right.
So, your daughter, you said, had called the ambulance, is that right?
She was crying. She thought I was dead.
Good morning.
Colleen McFarlane, please. Oops. Hello there, come in, Colleen.
Thank you.
Right, what can we do for you this morning?
I've got this thing on my hand.
Yes?
It's sore and it's getting bigger and bigger, and I put water removal on
Okay.
it, and it doesn't go away.
Right. And how long have you had it there
A
for?
couple of months.
Anything like this before or not?
No, and it's sort of this part here is getting bigger.
This is what's called a keratoacanthoma. Big, big name.
It's a wart.
Not quite a wart, no. Kerato means nail, and thoma means sort of a growth. So essentially, if you feel this in the middle, that's essentially nail.
Yeah.
And these lesions grow quite quickly with some redness, a sort of fleshy bit around the side, and they form a nail plug in the middle, and they can just keep getting bigger and bigger and bigger. But just looking at the size and everything, I think this is a benign lesion.
Why is it sore, though?
Because that bit is on a fleshy bit underneath, and when you press it, it's sort of on an open scab.
Because I always file it down so it doesn't catch. I take a nail file
And that's absolutely fine. A lot of people do that.
Yeah.
But it's quite uncomfortable doing that, I would imagine, because it's like a little plug of a volcano sitting on open skin underneath. I'll see if I can find you a little leaflet about it.
Get rid of it?
You have to cut them out if you're going to.
Okay, because I do have private medicals.
Okay, I can refer you to one of the dermatologists locally who will have a look at it and then probably remove it for you. Yeah?
Yeah, and I'll be awake.
You won't be awake.
I had an abscess under my arm. I went to the doctor and he said he's going to lance it.
Ooh.
Well, he said, think of a nice sunny beach, and I did, and he just went zap. Oh God, I don't forget it.
I bet you won't. You're obviously traumatised by it. Okay, and then I'll do a letter and then that'll follow it up.
Oh, fabulous.
You're welcome. Take care then. Bye-bye.
Bye-bye.
That woman asked me 5 questions in a row. She goes, just one more thing. Sound like Columbo. Just want one more thing.
Columbo.
Yeah, he used to say that, didn't he?
He's my favourite. He's my hero. Him and Miss Marple. That was been my nickname since I've been at school, Miss Marple.
No reception, Cindy speaking. How can I help?
Hi, come through. Yeah, good. Haven't seen you in a while.
I know. How's life?
Not bad. So you got a little one?
Yeah, one of two. She's a twin.
Okay.
She's had patches of eczema.
Yeah.
We got the Cetraben cream for it, but it's got really angry and really red.
When did it flare up, do you think?
A couple of days ago, actually.
Okay, we'll have a look. How's the other twin?
Yeah, he's fine. He doesn't have any.
Oh. Has she scratched it?
I think, here, look. See that? It's like severe.
if it was an adult, you'd almost start to think, is it a psoriasis thing?
Yeah.
But obviously at her age, you can't jump to that conclusion, and it's not very scaly on the surface. So I think it is a dermatitis eczema type thing. So we need to step up to a steroid cream.
She had it for ages. She has had it, but not really red, has she?
Okay.
It's not really red lately, hasn't it?
That's very helpful.
Angry.
So normally the Cetraban helps to calm
Yeah,
it.
well, we just pop it on every now and again.
Is she sleeping at night?
Yeah. Oh, yeah, brilliant. That's the thing. She's not unwell or anything like that.
Fine. Have you noticed anything if she eats, if it aggravates it, or is it just
I've
sort of...
not, to be honest.
And any pets at home?
Just turtles. Well, we've had them since they've been born and they're in a tank. So.
And they're quite hyperallergenic. So looking at her history, she's not had a steroid cream in the past. No. So I think given how it's sort of in many places, I think I would step up to something like Umivate ointment, which is just a step up from hydrocortisone. I would rather she have something a bit stronger, but use it for a shorter time. So hopefully in the next week, the redness will subside and you can carry on with Cetraban.
Use that with Cetraban as well?
Yeah. The other thing is if she is scratching and itchy, we could give her also an antihistamine type syrup. If you find it's making no difference with this, then we'll need to review it. Do you want me to give it to you?
Ta. Put it in the mouth.
I know, everything goes in the mouth. All right, see you later.
Say bye-bye.
Hope that helps.
Bye-bye. Thank you very much.
All right, take care. Okay, bye-bye.
Where's my phone?
I did put it on top of Nanny's handbag, so it's probably on the kitchen side.
No, I put it off and put it in the charger.
Ashanik Richards, please.
Come on, let's go.
Come in. Hello, come in. Have your seats, please. Right, how can I help?
Right, I rang for advice the other day, and they told me to come back in because I need to get her referral pushed to urgent rather than...
Okay, let's see what it is. Yeah.
It's just like normal because it was about her fit. Well, it was like seizures I explained to the doctor, and she thinks it was like, could be a form of epilepsy.
Okay.
But
usually we do it as urgent, if that's the case.
But when I rang up the other day, they said it wasn't. But what I actually did do was record it
Should we have a
so
look?
that I've got proof of what it looks like. And to me, it looks like the start of a fit. Started happening last March.
Mm-hmm.
She took an overdose and she ended up in hospital for a week. And the seizure started then.
Did they say it was related to the overdose?
No.
Okay. What did she take?
It was a concoction of like drugs. She was out with her friends.
Okay.
And it was a concoction of things. And she called them bang bangs, these little silver canisters. And it was that, yeah.
Okay.
Dr. James, he's very, very nice.
He is. He's a lovely doctor.
He's just, I felt comfortable in everything he said to me.
Dr. Sritharan. It's so, everyone says Dr. Shri, Dr. Sritharan. What's so hard?
He doesn't mind being called that, so
No,
I
I know
think
he doesn't. He doesn't mind anything because he's such a darling, isn't he?
He is.
Such a darling.
Yeah. So I'm sorry you're not seeing him today.
I don't know how your receptionists put up with it, to be honest.
They're really good, you know, those receptionists. Patients are the saints. Yeah, see, Dr. James came in, didn't he? I like Dr. James.
Yeah, he's very friendly.
You're looking well.
Thank you.
You're looking very fit.
Okay, thank you.
So how are you?
I'm fine.
Yeah.
Just before we went on holiday, I had to come for the blood pressure, and it was high. So the nurse said to make an appointment to see the doctor. I saw Dr. Giovanni. I call him Giovanni. I don't know why.
He's suddenly become Italian.
And he increased my blood pressure from 40 to 80 tablets.
Okay. Yes. Yes.
Then he said, make an appointment to see the nurse again. Took the blood pressure and it was high.
Yeah.
So he gave me some other tablets to take.
Yeah.
But they made me ill. They gave me diarrhea, chronic stomach pain. So I left them off.
Good. Good.
And then I thought, I'll try them again.
Okay. Yeah.
So I started trying them on the last Saturday, and I've been okay. My poo is a little bit stodgy, but it's not.
Okay, it's not constipated.
No, and it's not runny. or
Okay, at
anything,
least it's not runny.
you
Yeah,
know,
yeah, very good.
And that's been okay.
Have you got a machine like this at home?
Yeah.
Good. And do you keep a record of your blood pressure?
I did a record and gave it to Dr.
Jumanji, yeah. Good. Well, if I can just get you to hold that one for me, Barry. That's right. Says, well, you brought him along.
Yeah.
Yeah. So we just don't talk while we're just doing this.
(141/77).
Good. Very good. And the heart rate 98. Okay. Very good. Excellent. Yeah. Keep taking them.
Me a
Yeah.
month's supply.
Yeah. I'm
and
going to
then-
put them on your repeat. Yeah. Well, I'm delighted at your blood pressure. It's
good.
really good. I'm really
I
pleased.
got transferred from you to Dr. Gennard.
I know. Temporarily, we gave him the list, but I'm opening a list again. Yes, a great
We can
doctor.
get back with you, we can.
Yeah, you'll be able to do that within a month. You'll be able to do it.
I
Yeah,
like.
yeah.
He's okay.
He is
Fine.
nice.
I've
He's
never
very
had,
nice,
I've
yeah.
never had any problem with any
no,
of the
no,
doctors here.
He
no.
said he's off to see his brother in
Fiji.
That's right. Yeah, amazing trip.
And I looked up the flight, 27-hour flight it is, and I thought,
Really?
I don't think I could handle 27.
27 hours. He'll end up piloting the plane himself.
All right then, thank you, Dr.
Yeah, nice to see you, Barry. Yeah. All the best. Nice to see you. Yeah.
Right. Yeah, have you got the video?
Yes.
When was this?
This was Thursday.
So she was sleeping.
No, that's her, innit? Her eyes are rolling in her head. She's awake, but when she's like that, she's not responding to you. And her breathing's funny. Can you hear the breathing?
So she was awake at this time?
Yeah, she was
What
awake,
was she
yeah.
doing before this happened? Because she's lying down at the moment.
Yeah, because, when they come on, she can feel them coming. And we was downstairs, and she said, Mum, can I come to bed with you? So I said, right, yeah, OK. So I had to hold her hand because her legs started to go as well. So I held her hands, took her upstairs, and I put her in the bed. And then she laid her down, and it was a few minutes after then that it all started, and her whole body was shaking.
Mm-hmm.
But they weren't forceful, like convulsions. They were.
Okay. And when was this again?
Thursday.
And how frequent?
But
was it happening?
before they weren't like this. So it's like they're changing and they're different. Because before it's almost like people talked to her when she was getting like dead people talking to her, and she would cry.
Yeah.
But when they first come in, she smiles. She's got like a silly grin on her face. So I always know when they're starting to come as well and like she clicks her tongue. She hasn't actually had one since Thursday because they're not every day.
Yes.
Because
occasional,
before, because before she went a good few months without having one, but then they come all of a sudden again.
So you want the referral? Usually that's what we do.
Yeah, apparently it's been referred, but it's not on as urgent. And she
Okay,
said
no,
it
I
could
will-
take a long time, and I'm thinking, it could do more damage than good.
Usually they're very good. I mean, they usually triage their letters as well. And if the thing is urgent, with pediatrics, they're very
Because
good.
I still haven't heard anything.
No, don't worry. I will
strange,
make it
yeah.
as I will ask the admin team to change it to urgent. So we'll resend it as urgent. So hopefully you'll receive an appointment. But if you're not getting an appointment early, just let us know.
Okay, great. Yeah, because they were telling me like 6 to 12 weeks, and I was thinking, oh gosh, that's a long time.
I wouldn't worry. You should hear within the next 1 week at least. Okay, anything on video would be really helpful for the pediatricians to see as well.
great.
Okay?
Thanks very much.
You're welcome. Take care. Bye-bye.
Bye.
So this blocked ear, how long you had it?
Was it a week, 2 weeks? Yeah.
A week, do you think?
Yeah.
Yeah, you had it done. I'm just trying to think. It must have been a couple of years ago.
I can't remember ever having it, Ron. It's funny that. I'm usually good at remembering that. Obviously, I'm not. I don't remember having me ear done.
Good, come right in. You've got everybody with you today?
My whole family.
How are you? So this is Azan. Hello, Azan. How are you? I'm Dr. O'Donnell. How can I help?
He went for a tonsils operation in the end of May. Grommets put in his ears, and he had his nose. Adenoids,
Adenoids,
in his nose.
yeah.
Ever since he was 2 weeks, and he's been sick, he keeps vomiting. Now he's come up with a really bad rash all over his hand, he's swollen, on his face.
Is he vomiting once every day or once every few days? Or?
Once nearly every day, but for the last couple of days, because he's not eating and he's drinking a little bit here and there. And when I'm trying to feed him, it's just coming out.
Tonsils and adenoids are part of your defense mechanism. So when they're taken away, it does leave you without that protection. The main controversy is, are we removing tonsils and adenoids from children who don't really need that surgery? Are we exposing those children to risk and to harm without any real benefit? Just sit forward. That's right. Good. Just going to take your temperature. That's fine. We'll work out what to do.
It's gone down, we've been walking, so...
It's 37.2, so his temperature's okay. Yeah. And when did that rash come?
Do you know, this came this morning, I saw it.
Okay.
It was on his face as well.
Yeah. Just stick out your tongue for me. That's good. Just stand up and we'll have it. Yeah, that's fine. We'll just look in your ears. Yes, you can close your mouth for the moment. That's right. That's good. So his grometer's in there. So just open your mouth like a big shark. That's really good. Well done. Now he's going to look at your nose. Good. And so just sniff up for me. He is still quite congested. Any cough at all? Open
the cough.
Big eyes. Big eyes, that's right.
Every night. Cough,
really?
cough.
Yeah. OK, so what I think's happening, I think he may be brewing a bacterial infection called scarlet fever. Scarlet fever is a bacterial infection, and it causes a high fever and a red rash, sandpapery skin, and an unusual tongue, which is coated white, and looks a bit like a strawberry. I think it might look a bit like a strawberry in frost, perhaps. One of the interesting features about scarlet fever is that it is the toxin released by the Streptococcus bacterium in the throat, getting into the bloodstream and causing the red rash. And the red rash gives it its name. But also, I think he may have a localized infection in the operation site that is blocking his nose, which you wouldn't expect.
No.
So what I want to do is I want to give him nose drops, and I want to give him an antibiotic called clarithromycin.
Okay.
I want him to take that for a week, twice a day, morning and night. But I wouldn't be otherwise worried about him.
All right.
Yeah. There you go. So hopefully this will make you feel a good deal better, Azan.
Yeah, it's lovely.
There you go.
Thank you very much. Thank you. So
Well
bye,
done.
so thank you.
Hopefully
Thanks
he'll
very
get
much.
us in, yeah. Bye, Mum.
Bye. Take care. Thank you. Thank you. Bye.
How can I help you today?
I'm finding it very, very hard to breathe.
How many days has this been going on for?
This has been going on for months.
What did they say you've got? What's your diagnosis?
Avian lung disease, hypertensive pneumonitis.
Hypersensitive pneumonitis. Okay.
Yeah.
Okay. Let's have a look.
Sorry, doctor.
It's okay. Let's have a look at your last document. Take your time breathing. Let's have a quick look. Let's open your last chest clinic. Hypersensitive to birds.
Well, they told me to get rid of my birds because I had about maybe 500, 600 different types of birds.
In your house or in the back? Where was this?
Avery's, because I've always had birds from the age of 7.
Is this in your garden or in a special...
There were some specialist birds indoors, which I can understand was giving me this problem. So I got rid of all of them because it was very hard because they've had them since young birds.
Oh.
And I got rid of nearly 300 of them indoors. The others out in Avery's, and I don't even look after them anymore.
Where are these aviaries? Are they in your
in the garden.
In your garden?
All around the garden.
So you had 500. Wow.
Believe it or not, I got myself some squirrels. They're not feathered. So I got chipmunks and.
Is that in the house? Or?
That's in an extension, not in the house itself.
Let's do your temperature.
Yeah.
But the problem is all these things are causing sensitivity to your lungs. And the pigeons and the birds, obviously, they've gone, but cleaning them out, their feces, their stools, their feathers, everything has caused the damage in the lungs, OK? How many days do you feel now it's got more wheezier? Is it in the last 2 days?
In the last day. This cough as well. It's not like before. It's big lumps of, phlegm
What colour is the phlegm?
Normally it's that opaque yellow, but last few days and a couple of times it's had a blood streak in it.
Right.
I'm coughing up blood, I know that.
Has the phlegm turned green or is it still yellow?
It's green.
Now it's green. Okay,
Yeah.
how many days has that been going on for?
I would say at least a week.
Okay. Let's have a listen to your chest. Stand up for me, Mr. Disses. Let's have a listen. Pull this up completely. That's it. Okay, nice deep breaths in and out for me. Okay. So, take a seat. So, basically, when I'm listening to your chest, it's actually got very good air entry. So, both sides has got good air coming in and out. I think you need to go back on 40 milligrams. Do you have enough steroids there?
I have enough steroids at all.
This is an antibiotic that I want you to take 1 capsule 3 times a day.
Right.
Amoxicillin.
Yeah.
And then on top of that, lots of fluids, paracetamol, if you've got any pain. If you cough up pure blood, any fever, shakes, or the phlegm isn't getting better, or your breathing is not better, even if you're on 40, you need to go to A&E.
Okay, I will do that. Okay.
All right, and then come back and see Dr. Bolger.
Sorry, but...
It's okay. Well done.
Thank you for all your help anyway.
Take care, Mr. D'Souza. Take care. Bye.
Woman this morning made me laugh. Toilet's out of order. She goes in there. I'm with somebody knocking on the door saying, "Can you not use that toilet?" She goes, "It's all right, I've been now." Trust the people.
Ricky Purser. Yeah, come on in. Can I have a seat down there? How you doing?
All right.
All right, how can I help you today?
Where do I start? I've had a stiff neck for over a month.
Okay.
I've developed a cough.
Okay.
But because I live in a house that is... It's disgusting.
Okay,
I've got someone who lives next door who urinates in the hallway.
That's not nice.
And it stinks of like smelling salts. Kicking the guy out, but it don't make no difference. He said he's not going to clean it because he keeps urinating in it.
Yeah, so until he's out, he won't be doing it.
So it's just lots of things. My knee has got worse, but that's because I was assaulted the other day and it gave way and it keeps giving way.
So what do you need from me today?
I want a support for my knee.
Yeah.
I want some kind of painkiller because it's killing me.
Okay. What are you on at the moment?
Nothing. I meant to have seen a consultant and we had this ongoing thing because being straight with you, I'm scared to go to the hospital. That's what it really is.
Okay.
I'd rather have a support or some physio because I am not going... I'll be honest with you, I even know it's a local and I know I'm awake. I don't care, I'm not going.
Okay, right.
And I just want...
Okay, so we can do physio. I need to look at what the referral that was saying. But physio won't do anything if they think that orthopedics still have stuff to do with you because they'll be worried about making it worse. And knee supports, we don't provide them. You've got to buy them. Unless they're provided through physio, if they like particular things like or in A&E.
I'm on benefits, so...
Yeah, no, but that's what I'm saying. So even if you're benefits, the point is you'd have to go to physio and then they'd have to say, yes, there's a particular thing, isn't it?
But if it comes to me to buy it, then I'll just leave it and then I'll just let it go and keep going. Because I can't afford it.
We don't keep them, they're not prescribable.
Yeah, no, that's fine, that's fine.
It looks like when you did see them, they were planning on operating, weren't they?
Yeah.
So that makes it difficult because the truth is what you need to do is to go back and see them and see whether that's still the case. And you'll...
It's worse. It's a lot worse. It's still swollen.
So the bottom line is, right, pain relief I can do. That's not an issue, right? But a knee support I can't do. And surgery, if you don't go down the route of going back to the surgeons and seeing whether you still need surgery, then you're going to find yourself in a situation with a long-term problem.
Open your eyes, Dad. There's nothing to be scared of, it's just light.
Do you check this at home, the blood pressure? No? Okay, scared.
Is your belly? Is your belly? Is that cold?
She doesn't like cold fish.
Sharp scratch. Well done.
I'm scared.
I think we need to get it x-rayed.
Yeah. Uh-oh, I'm scared.
let me see if I can talk to him and talk him out of it.
Talk him out of what? The surgery?
Operating, yeah. Because
It's not about talking him out of it. He's just going to go and look at your MRI and go, it's worse. Last time I thought you need surgery, you're going to need surgery.
There is no way that I'm going to sit there while I'm awake. He can do it while I'm asleep, that's fine.
So what's the issue there about them keeping you awake? What do you mean? What?
Because I just won't be awake. I know I won't feel them, but you try to tell me.
No, but what I'm saying is they're not putting you under general because...
Because they said it's going to be a local. And there's no way I'm going to be awake.
Did you tell them that you've got a real phobia of that?
No.
Okay. They might work with that then.
You sure?
No, but you don't know until you ask them. Okay. I have an answer for you, okay? I will refer you back with the same original letter and I'll do a cover letter saying we're re-referring, you've got worse pain, and the reason that you keep not going back to them is because you're afraid about having surgery under a regional block, and you would consider it if you were given general anaesthetic. Yeah. Does that sound right?
Yeah, that's fine.
All right. All right.
Thank you very much.
Take
Cheers.
care. No problem. I hope it works out.
Thank you.
See ya.
Thank you.
Bye.
Bye-bye.
What's been happening?
Well, it was the day before yesterday at about 8 o'clock in the evening.
Yes.
I don't know what happened. I slept in the room on the carpet and then I hit my head on the wall.
Yeah.
When I opened my eyes, I was in hospital.
Right.
So my daughter called the ambulance to come and get me.
Yes.
So after I get my sense back, I just discharged myself. Yesterday in the morning, I feel dizzy, headache. Even if I cough, I feel headache.
Okay, let's just have a look at your notes. So your daughter, you said, had called the ambulance, is that right?
She's only 13 years.
Only 13?
My daughter, yeah.
Oh, that was good of her.
She was crying. She said I was crying. They thought I was dead.
So do you have any idea how long you weren't unconscious for?
I've got no idea.
It says that you had an X-ray and a CT scan.
I don't know. They did do X-ray.
It says that you did.
Well, I don't know.
Okay, so it looks like the CT of your head was cancelled.
Oh.
Obviously, because you weren't going to stay.
Yeah. This is the blood pressure.
That's your blood pressure, yep. Okay, just need to shine my light in your
eyes.
Yeah. Okay. Just want you to follow my pen with your eyes. In this way. Any double vision there?
No.
Can you puff your cheeks up for me? And smile. Okay. Close your eyes really tight. Just don't let me open them. Okay.
I hit it here.
You hear your head there? Let's have a look. Does it hurt?
A little bit. All this part.
So it's quite a wide area, isn't it?
It's a wide area, yes. Till here.
I think when you have an accident like this and you go along to the hospital, in the emergency situation, they arrange lots of investigations.
Right.
Because they don't always feel they have enough time for the assessment.
I was a fool. I was like confused.
Mm-hmm.
I wish I could have known now that I couldn't get out of hospital. I was thinking of work because I did have a very important job tomorrow morning.
Right.
So my mind, after being awake from hospital,
Yes.
said, well, it was just a bang. There's nothing wrong with me. I'm going home.
But you've probably got a bit of concussion.
Yes, I did.
And with concussion, you can have a headache.
Yeah.
You can feel a bit sick and a bit dizzy.
Yeah.
And the best way to get through concussion is to rest.
To rest, okay.
Yes. And you can safely take some paracetamol.
Okay.
So is somebody going to be around for you going forward over the next few days?
I'm thinking of going to work tomorrow.
I think you're going to. What do you do?
I'm a carer. I work in a home.
Okay.
Yeah.
Do you feel up to going to work tomorrow?
Well, there's some people that need me very badly, so I think I will try.
Okay.
But I don't know. It's you to tell me if I can, okay. If I cannot, I will stay home. What do you think?
I think if you feel well enough to go,
Yeah.
that's okay, especially if they need you. If there's any reason why you don't feel well enough, though,
Then don't go.
go.
Okay.
Okay.
All right. Thank you very much, doctor.
Okay. All right.
Okay. No
Well, nice
problem.
to see you.
Okay, no problem.
I'll see you. Thank you very much.
Thank you very much.
I'm not so hurry, but I want to ask about the appointment for Saturday,
Right,
Sunday.
for Saturday and Sunday, unfortunately, those are pre-booked appointments only.
Okay.
If you do need an appointment for tomorrow or Sunday, you need to come back at 9:15 in the morning.
At 9:15?
In the morning.
Okay, okay.
And just check to see if there's any cancellations.
Okay.
Okay?
Okay. Okay, thank you.
No worries.
Thank you, bye.
Nice to see you again.
Right, and you.
Tell me what brings you in.
Right, I saw Dr. Napfi, my doctor.
Yeah.
And because I'm nearly off my methadone, I've been put on a rapid reduction. I'm nearly off it.
Okay.
Because we're having a baby.
Yes.
Basically, my chronic pain in my back and my legs has come back.
Joseph's been in a specialist drug treatment centre. Joseph started using heroin at a really young age. He was only 15. He's now 32. So a period of 17 years of using heroin. We have been reducing his methadone medication, and he's done really well.
You know what I mean? Being sat down all day.
Yeah.
If I'm either in this or on my mobility scooter, or I'm sat down at home, so that doesn't help at all with my back pain. You know what I mean? Because I damaged my back about 12 years ago carrying a washing machine.
Okay.
And like I was frozen.
Yeah.
I couldn't move for about 2 weeks. I had to move in with my mum. But obviously the leg pain has got worse and worse. But obviously when I was on methadone, that obviously helps with your pain as well.
Yeah.
And obviously I'm nearly off it now.
Your dose at the moment is
20.
And how long to go before you're going to be off it?
Well, 3, 6, 9, 10, so 11 days.
11 days, and you'll
I'll
be completely off. Okay. Was that your choice to come off it completely, or?
Well, I wanted to get off it quick as soon as I found out my wife was pregnant.
Okay.
Because I haven't been using the gear.
Yeah.
So I thought I can handle it. Do you know what I mean?
So we've got a few options.
Yeah.
And it's worth remembering that you are a patient who has chronic pain.
Yeah.
Okay. So getting this right first time may not be easy. Okay. The easiest way for me to kind of describe this is going to be to kind of draw it on a piece of paper for you. I think we're going to continue with your gabapentin, okay, for now. So if I put gabapentin here and I put a tick beside it and you're on top dose there. You're on cocodamol.
Yeah.
Which is that combination of paracetamol and codeine. Now, if we separate those two out, I would like you to carry on with the paracetamol bit to it.
Yeah.
8 a day.
Right.
And to replace the codeine, which is effectively 8 a day.
Yeah.
When it was cocodamol.
Yeah, but just one tablet.
I'm going to replace that with tramadol. And because we have shelved naproxen, I think we need to. This is a class of medicine called anti-inflammatories.
Yeah,
I think we need to bring back a type of anti-inflammatory, but I think we'll bring back the ibuprofen.
Yeah. I'm up for that and see how we get on.
See how we get on. The difficulty we have a kind of a stepped approach to pain relief. And once at the bottom of the kind of approach is simple things like ibuprofen, paracetamol, the higher you get up the pain relief ladder, you're going to come into kind of opiate-based medications. And we do need to be careful in someone who's had a heroin addiction. Okay. Moving forward, if this is not working, can I suggest that you come back and see us?
Yeah.
Is that reasonable?
Yeah, I think that's...
Yeah?
Yeah, that'll work.
Okay.
Thank you, doctor.
It is a difficult situation. Remember I said you're already on opiate-based medicine now. And what we need to be careful and mindful of is one addiction can often be replaced with another. And there's lots riding on it, obviously, with her expecting. That's good news. Are you ready for nappy changing and all of that stuff again?
Excited.
Good.
All right, doctor.
Take care.
Thanks a lot. See you later.
Bye.
Yep, takes it in the waiting room. She'll call you shortly.
Glenda, you know everything, don't you? Do you know how long that glue's been out of order for?
Yes, a couple of weeks now. Some gentleman sat on it one day and the seat pinched his bottom. Alison told me to put that on there.
2 weeks ago. OK then, thank you. All right, bye. That's why you're saying you're Miss Know-It-All.
Miss Marple, I told
You are, aren't you?
Unique. I'm Miss Marple.
Come on in and have a seat, Sean. Dr. Bolger. How can I help this morning? Something to do with that, I imagine.
Yeah, I don't know what's going on, but my INR is extremely high. It's 7.7.
I'm sorry, you're INR?
Yeah, because I had that blood test done this morning.
Right.
So I had to go and see the doctor about that.
Sean's had repeated DVTs, so that's a clot in the veins of his legs. Some people who have recurrent DVTs, the call's made that it's sensible to keep them on warfarin, and Sean is on lifelong warfarin. Why is that shot up? Been taking any tablets for this?
I've took Anodine.
Do you know what's in it? Because Anodine's a brand name.
Yeah.
It's got anti-inflammatories in it.
No, I didn't even check. I was in so much pain I didn't care.
That may be.
Yeah, it could be the reason.
Could be the reason, yeah. Anti-inflammatories are one of the many groups of drugs that interact with warfarin. It can mean that the INR goes up. A high INR indicates that your blood is too thin, that it's going to take too long to clot, and that puts you at risk of bleeding. No bleeding anywhere, no bruising?
Nah, but this pain is unbelievable down this way.
And when did that start?
Yesterday.
Out of the blue? Did you injure it?
It was playing up a bit. No, I don't remember injuring it. That's the thing. I don't remember anything happening.
OK, and is there any bruising or swelling there?
Well, you can't really see things. Wrong complexion. It just hurts. Like I can't handle the pain.
Right, let's get you up on the couch. You slip your trousers down for me. Let's have a proper look at the whole leg. OK, swing your legs round. So which leg are we talking about? It's very tender, isn't it? Hurting when I'm sorry.
It hurts. The push there, it hurts a lot.
Mm-hmm. It might be tied into your INR. It can be tied into your INR one of two ways. It could be a clot in the leg. Well, not with an INR of 7.7. Your blood's very, very thin.
Yeah.
There could be some bleeding in there, yeah? And that's what's causing, because it's very tender, it's very tense. Right. I think I might need to get some advice from the hospital doctors today about whether or not we need to send you up.
Describe it to me.
When it's coming, I hear it's like... brrr.
Sounds like a train.
A little bit.
You know when you get up too fast?
Yeah.
And you go, whoa.
Say
It clicks and it really hurts. And I can feel it like a popping noise.
But this one's still not quite right. And when I go like crunch, 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 okay.
Yeah.
The trouble with the trade names is that sometimes they have paracetamol and ibuprofen in, and you know ibuprofen messes up your warfarin, yeah? But what we want to do is we want to get them some advice about whether or not we actually need to do anything else and get them to have a look at this leg, OK? When I examined his leg, it was very swollen and it was very tense. It felt full. And with knowing that his INR was raised, so knowing that his blood was thinner and that there was a potential for bleeding, that's what I wanted to rule out. If a patient were to be bleeding internally, it can be very serious and ultimately even fatal. So you all right to take a seat in the waiting room?
No problem.
Yeah? You get yourself sorted out.
I've been in the last hour, so...
Oh, I'm sorry. I will just talk to the medics and we'll get some idea about what we need to do next, OK? Take a seat outside. I'll make some... Keep that with me, please, yeah? I'll let you know what's going on, OK?
Thank you.
And can I make an appointment while I'm here as well? The doctor that I saw last time, a woman, she sent me to the hospital. And that was just a waste of time, so I need to go back to her and say to her what happened. It was just ridiculous. Doctor wouldn't even look at me, he wasn't interested. He was a busy man.
Oh my God,
He must have been
really?
about 25 if he was a day. I've got grandchildren older.
Hey, Sean, come on in. Hiya. Spoken to the hospital and they want to see you this morning to check this out, OK? It's not impossible. It's more muscle problems in the leg, but it's odd that you don't remember doing anything and it's odd that your INR is so high. So what we want to make sure is that the pain in the leg isn't due to any active bleeding. If it is, then what they'll want to do is give you something to reverse the warfarin, yeah? Okay. And give you some painkillers that you can take that isn't going to mess it up more, yeah? They're going to see you at ambulatory care at Wexham, yeah? So if you go up to A&E, and explain. You've got an appointment there at 10 o'clock. I'd go straight up there now. Is that all right?
Thank you very much.
It's no problem, yeah?
you.
So they're expecting you.
Okay.
Yeah?
Thanks a lot.
Bye-bye.
Bye.
He was sucking a sweet as well, which is very, very, not at all. Shouldn't be done. But he was sucking a sweet in the end. Now my legs are killing me. I'm walking with a stick and I'm getting worse. I might as well just sit in bed and die.
Can you come tomorrow at 11:40?
Yeah, that's a lovely time for me. Just scribble it down on something.
Yeah, I will, yeah. I'll write it on a card for you.
But I don't know what day of the week it is anymore.
Down we come. Down we come. We're almost there.
Do you want me to run and see it?
I've got a delightful young lady sitting in with me, though. Is that okay?
That's wonderful.
Here we come. So we're going to jab your other knee today, yes?
Can I sit up here?
Yes, let's.
Go on, sit down then.
No, let's get you up here in any case, because it's not as good as my other bed, which goes up and down very nicely.
Sorry. You can hear the bones cracking.
Yeah, was that your bones?
It's terrible.
So I'll get it ready, okay, and then we'll get
Thank
you
you very much.
swiped around so we can get
Thank
that
you so
done.
much.
I've got this bit ready already.
It was only a pleasure to hear the call come from you.
Oh dear. Yeah, not many people say that.
So what university are you at?
Oh, I'm actually passing writing.
Yeah.
I know. Yeah, so I'm one of the junior doctors.
Okay.
Yeah, so I'm in my second year. I've just done a year in hospital. It's nice to come out here though. I've never really spent much time here.
Lovely.
It's a lovely area of the country.
Burnham's lovely as well.
Oh, I've heard, yeah.
very
I think one of
nice.
the GPs said around there. He was telling her it was very delightful.
Was that Dr. Delicious saying that?
I'm sorry, no?
Mange. This is what they call him out of the drug clinics that I work at.
That's the delicious looking doctor.
Not sure about that. Most people say, oh, he looks like David Cameron. Yeah.
It's true.
Right, okay. Shall we try and swing you round?
You're all right.
Yes.
Almost there. This one needs to move over a little bit. Good on you.
Thank you very much.
So the object here is to try and find the kneecap. and you just sort of pop it down into underneath the kneecap. And the knee's easy because you know when you're in there, because if you inject, it goes in.
Does it
And if it doesn't, then you know when it's soft tissue and it's, and it hurts. There we go.
Thank you very much. That was lovely.
Lovely.
It wasn't sore.
Wasn't sore at all?
No.
I didn't really do it. Oh dear.
Yeah. Thank you very, very much. I'm so happy for this.
You're welcome.
Thank you.
Right, let's give you a hand up here.
Thank you, love. Thank you very, very much, love.
There we go. That's yours, Beryl. And so roughly 6 months, yes?
Yes, thank you very much.
Good on you.
Don't you want to operate on them now?
Well, yeah, we'll come back in about half an hour when I've finished, and we'll just do it.
Oh, sure. Thank you very much. All the best to you, love.
Bye-bye then. Yeah, see, I don't get Dr. Delicious like Mange does. So. Oh, dear.
Right, say bye to the doctor now.
You're going to wave. We're going to wave. There's a bit of a kind of opening of his hands there. Fantastic.
Bye-bye. Nice to enjoy your last day.
Bye-bye.
Bye-bye.
Thank you very much.
That's all right.
Thank you.
You're welcome.